Hi. All right, let's see if it works again this time, y'all. Thank you for your patience. It looks like we're going to be able to get this tech going correctly this time. We're going to have Dr. Moshe Dekel on here, a holistic medicine physician, for you to speak with and ask any questions to that you would like. I'm Siris Rivas. And I interviewed him on the Choosing a Different Future vodcast that I host. It's on YouTube, and there's also a Choosing a Different Future show Facebook page. And so hopefully Dr. Dekel will be able to join us this time around. We had to work out some technical glitches. But until then, yeah, feel free to pop your questions for him, whatever they may be, about holistic medicine, bodies, health, even traditional medicine. He's an OBGYN as well. So we have a bunch of things that we can talk about today. How does it get any better than that? Awesome. And here we see that he's being added on. How does it get any better? Yay, yay, yay. Working out technical glitches. So, um, okay. There you are. Hi.
Hallelujah.
I know, right? So is this your first Facebook Live?
Yeah, crazy, huh? Modern technology, it's great when it works, but it's not so great in work.
So congratulations on getting on. Thank you for being on here. It's
My
even for
pleasure.
all of us. Look, there's Dawn Hecht who's saying, "Hi, Dr. Dekel. Yay, awesome." So I'll let you know
Hey,
the
John.
questions that people say. She's like, "Oh my God, been way too long." That's lovely. So one of the things, so Dr. Dekel, I was just saying that that you were on my vodcast, the Choosing a Different Future, and we got to talk a little bit about holistic medicine. And people were asking for more. They were asking to ask you some questions and get to know you a little bit better. And I get it. I adore talking to you. So I was like, okay, twist my arm. I guess I'll talk to Dr. Dekel some more.
Thank
And
you.
so, one of the things we talked about in the podcast, for those of the people that haven't gotten to watch the YouTube video, and I'll put the link for that below after we're done, if you want to check that out as well, is we were talking about your transition, your choice to move from traditional medicine to holistic medicine. So, what led to you making that shift? Because for many, that seems to be very, very different worlds.
Yeah, it's a great question. In fact, that's probably the most frequently asked question of me, of why did I change from being a surgeon, OBGYN for over 20 years to become a holistic physician? And my answer usually starts by saying that it's a good one because I'm not aware of any physician that wakes up one morning and decide, okay, today I'm going to become. It just doesn't happen that way. In my case, and usually there's a personal story. And my personal story is that uh, for years I've been having neck and back issues because of looking down at the operating field for 5, 6 hours a day, delivering them various positions, etc. Then one day back and my neck and back said, "You're out." Simple as that. I was going to do a delivery and changing it to my scrubs, and I found myself on the floor. And
Yeah,
this
and
was a
I think that's really
realization.
commendable because a lot of us have those moments where we have this pain and physical discomfort, and we might not have listened to our bodies like you did.
Well, I thank you for the compliment, but I a long time I was going tractors and doing neck traction, trying to alleviate and resolve it, but I did not take the activity that actually caused the issue out of the equation. And therefore, at
Mhm.
one point, my body said, "This is it." And at that point, I just could not ignore it anymore for two reasons. Number one, uh, I cannot afford to have that while I'm doing surgery, that's for sure.
Yeah.
Jeopardize my patient safety. And secondly, I realized, I'm not doing any benefit from my own body. If it tells me you can't do it, you can't do it. So not a good day,
Mhm.
uh, to put it mildly. Trying to do it and you do it for 25 years or so. But I opened a door, or I looked for an open door where this one closed, and I discovered, in a way, holistic medicine, which I'd like to call the real medicine, And I was totally astonished to see how much I was not taught in medical school, in residency, and in 20 years of postgraduate courses. And I had to re-educate myself from scratch and accumulate the knowledge and really start my practice. I had to abandon the model of insurance because the insurance model is 6 minutes per patient and move on. And
Yeah.
currently I take an hour with my patients, so it's a totally different practice. But the gratification of finding out that this is an endless journey in learning because there's so much out there.
Yeah.
And I learn on a regular basis, go to a lot of courses, and actually I'm able to help my patients in a much more profound way and actually help them change lives. So this
So
is
what are
really,
some of the things that your patients have meant? Because a lot of your patients have come from seeing traditional medicine doctors, and then they come to see you. And so what are some of the feedback that they get you with that transition as they're like acclimating to holistic medicine and to your style of and your approach?
right. I would say that about 60% of my patients have seen few conventional allopathic medicine doctors. And they come to see me because they were just not helped with their issues.
Yeah.
They were put on a lot of different medications. They put a lot of testing, a lot of, you name it. Bottom
Yeah.
line is they're not getting
I was
better. And
there, so I know all about that. I
right.
know that well.
And after a while, they say, well, maybe I need to look at a different place. And holistic medicine is in the news, word of mouth. They talk to friends, they talk to family, etc. So, why don't you try that? And then either I get a direct referral from a patient of mine, which is obviously the best referral, or patients find me on the internet. I mean, they do a search, holistic doctor, or breast thermography, or bioidentical hormone replacement, or whatever they feel they need, like let's say adrenal fatigue, or fibromyalgia, or thyroid issue. No matter what the problem is, my job in holistic medicine is to actually get down to the foundations of the issue and help them fix it in a natural way without prescribing medications.
Yeah, yeah, and without having all the risks and side effects. That's really great. So, you mentioned a couple of your services, and some of which before meeting you, I didn't even know about, like the thermography. Could you talk about what thermography is?
Yeah, it's kind of interesting because thermography actually was the first modality that I actually was exposed to starting the holistic medicine journey. And I had not result, but the same idea or the same thought like you did, I've been an OBGYN for over 20 years. How come I never heard of it?
Yeah,
Uh,
I have
thermography,
breasts. I'm like,
thermography,
I have breasts. I should know about this.
I know that breast mammography creates a situation with compression, increasing your chance of getting breast cancer by 1 to 2% every time we do it.
Right.
So, and thermography has been around for 60 years. I mean, it started in
Mm-hmm.
Europe. And today, with the advent of fast computers and great infrared cameras, I mean, we can actually see the future in a way by utilizing thermography, which is really looking at the emission of heat from the breast, analyzing it, and see what kind of risk factors we have, and have actually a protocol to prevent it. So, conventional
Yeah.
medicine tells you early detection saves lives. I tell you that early prevention saves lives. I don't want anybody to have the disease. And cancer, breast cancer, or any other cancer is totally preventable and much easier to prevent than to treat. So I started that and I offer it to my patients. I do it in conjunction with ultrasound because the thermological testing looks at physiology of the breast with heat emission. The ultrasound gives us an anatomical picture of cysts, of lumps, and areas of densities, etc. Together, we get a very, very good idea of what's happening in the breast, what needs to be done. without exposing you to radiation compression.
That's awesome. That's awesome. How does it get any better than that? So before I forget to mention, I mentioned in the first take, but when we had the technical glitches, anyone on here listening, please go ahead and post any questions you have to Dr. Dekel right below here, and I will read them out to him as we're conversing. So feel free to ask him any questions about what he's saying right now, about holistic medicine, bodies, health, anything with obstetrics and gynecology. I mean, you name it, this is a wealth of knowledge here. Oh, David and Don are asking, when will we see you soon? They want to see you soon. David Marino.
Yes, I don't. Yeah, and I'm going to be in the 18th to the 25th of April. I'm actually in New York about 7, 8, depends, 7, 8 to 9 days per month. I am actually a resident of South Carolina, Hilton Head, but obviously I take care of my patient in New York. So yeah, about between 7 and 8, 9 days per month. So you just call Robin and she'll schedule you as usual. Nothing changed there.
Yeah, you got some other patients here saying, it's been a while since I've seen you,
Hi,
so they're
Daniel.
booking appointments. So cool. One of the things that I love, because I've actually gotten to see you interact with your patients, is that you are so caring and loving with them. You mentioned that you spend about an hour with them, and that's unheard of in my mind, like before meeting you. Even the amazing doctors that I've been with, and I've been lucky that they really, a lot of them, both traditional medicine and naturopathic, were very caring with me. Because of that insurance model that you were referring to, they couldn't really afford to sit with me as long as they could. And the ones that pushed it, I know that they were kind of risking their bottom line. And so I really love the relationships that I see you building and with your patients. The other thing I find unique is you give your patients your cell phone number. Like, who does that? Like, how many doctors do you know you have the direct line? You can call them wherever they are. What made you choose to do that? And did you always have that as part of your medical practice?
Actually, very few, if any, give their cell phone to their patients. I have the simple opinion that if a patient needs me, they don't want to speak to my secretary, they want to speak to me. So, and it's funny because nobody abuses it. They don't call me if they don't need to, so they can call me, they can text me, they can email me. And it's easy. I mean, it's cutting the communications by half instead of calling, let's say, Robin, and then she looks for me, et cetera, et cetera. Now, I'm not saying that every time that anybody and everybody calls, I'll be available, because I do see patients and I do have meetings and I do have other issues going on in my life, obviously.
And a life, you have like fun and
Once in a
yeah.
while, once in a while, I have my own downtime.
Right.
But I usually get the same within the same day, and I tell them, listen, if you send me a message I didn't get to you within a day, that means I didn't get it, or it kind of went by without me noticing it. So please call back. And it's been working very well.
Awesome. Awesome. Gosh. So the other thing we were talking about, you mentioned a couple of other services. So what's something else? What are some of the other services that we provide that are unique to your practice and to holistic medicine?
Okay, great. Well, first and foremost, let's define holistic medicine, because
Yeah.
it's a big to do. It's a big headlines. Holistic medicine. Put in simple terms, a physician in holistic medicine, integrative medicine, natural medicine, you call it whatever you want, it's the same thing. It's really listening to your patients, and listen carefully, because they will tell you the story. And once they do, it is your job to find out, okay, patients are talking to me about symptoms. I have a pain here, I have a pain there, I cannot sleep, I have no energy, whatever the case may be. This is a symptom. A symptom is a messenger. Okay. So conventional medicine is killing messengers by giving prescription drugs. In holistic medicine, you're actually analyzing the message, okay, which is the symptom. And you say, okay, when you have symptom like that, where is it coming from? What is causing it? Kind of go deeper into the well to find out, okay, what's down there? And once you identify it, you see what else is involved? There's not just one system of the body which is involved in healthcare. I mean, everything is connected. So
Yeah.
your job as a physician in holistic medicine is to identify all the moving parts. Okay. And the idea is to address all of them, whether it be
Yeah.
dietary, which most of us need addressing dietary issues. Okay, what we eat. Next thing is how we digest it. That's absolutely paramount. I tell my patient, we good gut, you don't have good life and you don't have good health. Okay. After that, you look at hormones. All right. You look, do they have any other issue with energy? Okay. Any issue with sleep, any issue with fatigue, any issue with anxiety, panic attack,
Mhm.
and on and on and on. Let's not forget the emotions. The emotions are absolutely incredible, incredibly important. And talking about emotions and other modalities, about a year ago, I came across access consciousness.
Yeah.
And thanks to you and Sulma, obviously, you kind of took me into the fold and opened up to the ability of what access consciousness do. And it's not a joke, but it's funny. Uh, I think I've sold
I'm
more
kidding.
books of Dane's books than anybody around. Okay,
That's true.
if anybody on is, you know, being you, changing your lives. I mean, I tell my patients, read this book, it'll change your life. And then I
Yeah.
give,
Dr.
and I,
Dekel is a walking commercial for this book. And if Dane here ever watches this video, if you guys see him, you want to send him this video, Dr. Dekel loves your book and the Being You, Changing the World book. And we can put the link to that as well under this video. If you haven't read it, it's phenomenal. And it's really about acknowledging you as a gift and you being you and not getting so caught up in everything else that you're aware of from other people, because we're all very aware of other people's thoughts, feelings, and emotions. And we're actually willing to be us and we have tools to do that. It can revolutionize our life and it can be an invitation to everyone else in the world to be them and to have more ease, joy, and glory with their life, with their bodies. And absolutely, it affects your health. And so your patients seem to really love that book.
yes, they do. And I've never so far received any bad review of the book. Everybody tells me how we change their lives. Those who elect to either call you or Sulma and take your workshop, definitely changing their lives. I mean, it's almost too canny or too almost like it's hard to believe that a relatively simple modality can change somebody's life. But when we come from the knowledge that 90% of our physical issues stem from emotional issues, obviously, if we don't take care of the emotions, nothing else is going to be as happy as you want it to be. So it's paramount. That's one of the things that I've learned justly. So it's a journey that I love because there's so many new in the field. Like I just recently got involved with stem cells, which is just totally fascinating.
Yeah,
Uh,
that's exciting.
uh, you know, and again, it's an infancy,
Hmm.
and you really need to sift through a lot of garbage, really, to get
Hmm.
to the gems because a lot of how would I put it? There are a lot of claims, and especially from the manufacturing side, not much from doctors because they know better. But there's so many different companies that manufacturing cord blood stem cells and cord Wharton gel stem. So everybody's giving their best pitch to tell you how many cells they have, what kind of survival rate, et cetera, et cetera. It took me a whole year to actually find out which companies are serious then. And actually, I went all the way from Utah to Florida and going soon to California to actually visit those labs to actually see for myself that what I'm recommending to my patients is actually the true good product that will actually
Yeah,
give them what they need to have.
that they're legitimate. That's awesome. So, could you speak to what stem cells are? Because not everyone knows what they are, even if there is a lot of news and and information about them out there, and then the difference between those different kinds of stem cells that you were talking about, just quickly, just so we can get an overview and they can get an idea of
Right.
what that is.
Right. Stem cells have the capacity to become any cell in the body. In other words, a stem cell is like almost, it's called a progenitor. In other words, it's the, how would I put it? It's the building block of just about any tissue cells in the body. In other words, stem cell can become a cartilage cell. It can become a skin cell. It can become a nerve cell, a stomach cell, a gut cell, et cetera, et cetera, et cetera. So when we're born, we are born with quite a bit of stem cells, okay? And as we age, the number of stem cells go down. In fact, the task of stem cells in our body is to repair. We have an injury, stem cells get to the area and really fix the damage, okay? So stem cell can repair organs, can repair just about anything. And you say, well, how do they know where to go? I mean, stem cells are very small, and we have a relatively large body comparison to a single cell. So how do you know where to go? Injured tissue, injured are selling like an SOS signal, cytokines. Cytokines are molecules that are actually calling the stem cell to the area of need, area of damage, area that need to be attended to, and that's where they go and repair it.
So it's like
The
beep
problem
boop
is
beep 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 boop beep beep boop, and then they
exactly.
go and they're like, I hear it, I'm coming, and then they go there,
It's,
zoom.
it's like it's like R2D2. They know where to go. The problem is
Yeah.
as we as we age, we don't have as many. They don't repair themselves they don't replicate as fast and as efficiently as somebody who's young in their, you know, a teenager or 20s and 30s, etc. So the idea is that considering how many of us have issues that are related to chronic inflammation and damage to tissues because of that, and let's take a simple item with, you know, let's say a knee problem, or a hip problem, or shoulder problem. I mean, if you talk to people that you know, you're going to find at least 2, 3 people that had either knee replacement, hip replacement, shoulder replacement.
Yeah, I can
And
think of
you know,
many.
and it's now in the consciousness of people. It's like not a big deal. I'm going to my shop and I'm going to report, not
Mm-hmm.
realizing that on knee replacement, okay, the numbers are the following: a third is doing well, great, it worked for them. A third is not doing too well, and a third it failed. And here he goes to a major problem, major surgery, major anesthesia. Any anesthesia at later age, and any age, but over 50 or 60 or even 70, you're going to come out of anesthesia with cognitive impairment. In other words, you're going to come out of it with less cells in the brain that you went into it. And that's a major issue. Okay, so stem cell, for instance, done the right way with the right product and oversight and addressing everything else, like the inflammation that caused it to begin with, or the overweight that is, you know, the knees were not designed to take 250 pounds on them. Okay, so we there are no miracles out there. The stem cells do a great job, but we need to look at the holistic picture, and that's
Yeah,
why
the
holistic
whole,
medicine comes into place.
all of the
You know,
options.
any orthopedic surgeon can put some cells into your joints and, you know, and say have a nice day. Good luck. There's more to it, and that's why it took me a whole year to investigate it, find out, okay, what do I need to know? So I'm not going to become just a technician, just putting cells in somebody and say, okay, good luck. Okay, so there's much more, but it's it's fascinating. It's fascinating because it works well. I mean, we'll get tremendous improvement. We're actually with the modality that we are actually developing is actually getting excellent results.
Could you mention some examples? I think you mentioned to me the woman who was all of a sudden able to see clear after getting some injections from you. Could you speak to some of the examples of some of the things that and how quickly the results can shift after getting some of the stem cell injections?
It's an excellent question. Some of them will get very quick results using also some additives that actually reduce inflammation. Usually, it will take 2 to 3 weeks to feel better. The stem cell will continue to act for at least 6 months. So
Wow.
the regeneration will last for months. It's important to give them good counseling as to what kind of activity they should do because some of them feel so much better that they think they can sign up for the next half marathon.
Yeah.
Not a good idea. Not a good idea. So I suggest, walking is great. Okay, don't overdo it. Let your joint repair itself slowly, and just use common sense. Don't do anything that you feel good about, but the joint says, "Oh, I'm not ready for that,"
Yeah,
and
like
then you
build
kind
up
of
to it
then you
again.
kind of
Gotta.
then you go backwards. That's not a good idea. So
Mhm.
we also do physical therapy. We do also cold laser that we add a variety of different issues and nutrition and supplementation to actually address oxidative stress, chronic inflammation. So again, it's a holistic approach, not just simple injection and the rest.
So, speaking of the supplements and things like that, I know that there's a lot of information out there about NRF1 and NRF2. Can you speak to like what that is and what benefits, if any, for the body that it can
Yeah.
provide?
It's kind of interesting because along my career, I've heard about NRF1, NRF2, uh, but not enough to be able to say two smart sentences about it until about
Okay.
until, it's an activator. Yes, it's a protein. Yes, it goes to the something like that.
Sure, sure. You're like, yeah,
But
that.
but
I think
but a year,
I've.
but a year ago, uh, a friend of mine introduced me to NRF1, NRF2 product, and I said to them very nicely, I said, I have about 80 different products in my office that they work great, and I really don't need another product in my office. And they said,
Mhm.
that's okay, but before you say no, check it out on PubMed. I said, PubMed, what does it have to do with PubMed? PubMed is the website for the National Institute of Health, where any study to get into that has to be three experts in the field. That's why it's called peer reviewed to get in there. So what does it do in PubMed? Because this is conventional medicine. This is holistic product. But I didn't see the connection. They said, well, it just so happened that we have 23 studies on it. I got my curiosity
Ooh.
and I start reading the articles and the studies. And I realized that the NRF2 decreases oxidative stress by 40% in 30 days. I don't have any product in my armamentarium, in my library, and when I saw that they actually proven on lab tests, it really captured my imagination. And I said, well, a lot of the issues we have of oxidative stress and inflammation, and I have a product that can reduce it 40% in 30 days. I need it. Not only I need it, I need my patients need it. The counterpart, the NRF1, so it actually affects it. It stimulates the mitochondria. The mitochondria are small cells in each cell that actually makes energy. It makes ATP, which is the energy of the cell. So our energy and our health totally depends on how much energy we make, and therefore how many mitochondria we have, how effective they are, and how much energy they make. So the NRF1 supports the mitochondria. The NRF2 decreases oxidative stress. So together, it has a tremendous uh, on health, and it's really a protocol in my practice. In other words, in addition to everything else that I recommend, I highly recommend the patients to get it. There's a short video about it, and there's studies about it. So read and see if there's that you want to do.
And we'll put that video. We're going to have a bunch of links for y'all under this. So we'll put that video under the chat for you as well. So, what are some of the things that some of your patients have already reported as benefits from taking the NRF1, NRF2 supplements? And do they
First
do
and
this? Is
foremost,
this a supplement that you can take like every day, even if you don't have a problem, or is it only if you're already having a existing issue?
it's a great question. The answer is yes to both. In other words, even if you don't have any issue, the system, the NRF1, NRF2, the potentium system actually proven to increase lifespan by 7%.
Wow.
Okay, so in human years, it takes.
Uh-oh. You're frozen? So you still have me, y'all. Hopefully Dr. Dekel will be able to get back on. Maybe it's just me and I'm seeing him frozen. Do y'all see him frozen as well? Let me know. But we'll definitely get him back on and you can ask him some more questions. We'll put those links below for you. Wherever you are, Dr. Dekel, hopefully you'll be able to receive this message from me. Thank you, thank you, thank you so much for taking the time to answer questions with you again in the future. Bye, everyone. Have a wonderful day, afternoon, or evening wherever you are.